Hey, everybody, welcome back. Question for you, Doc. If you don't have dental pain, you don't have problems. True or false?
False.
Let's talk about that on today's version or episode of the Daily Dental Rewind. All right, welcome back. We're going to talk about that. I'm Dr. Smith.
I'm Dr. Juricek.
And in discussing our day today, that's kind of a topic that we ran across. So I had a patient that had a bridge that I placed about 5 years ago, I believe, and up till the last X-ray we had, things have been good. She kind of fell out of the routine. I think for the last year and a half, we hadn't seen her, but she presented today with pain in her tooth on the back side of that bridge. And you can look at this photo, and we'll pop it up on the screen. This area where the bridge connects from one tooth to the other, this is where these are always the most susceptible. It's like right where the bridge meets the tooth, and it's just, if you're not flossing, if you're not sticking stuff through there to kind of like debride it and get all that bacteria and food out, it tends to decay. But it doesn't seem to be really significant decay, but she's in a lot of pain.
Yeah.
And in those moments, like, there's no way to fix that without taking off the bridge, trying to fix the tooth and moving on. So in her case, we've just decided that tooth has really probably seen its last effort.
Right.
So we're going to take it out, put in an implant, and build a new bridge to it. In your case, you had a different scenario.
Right. Yeah. I had a new patient come in, sweetest lady. She hadn't been to the dentist in a really long time. From just kind of just in denial,
Was
just
it like
not
5
really
years,
wanting
10
to
years?
come and, 10 years. Yeah. So just hadn't come in for a really long time, but had no pain. So we took a lot of x-rays, and I looked in the mouth, and, there was a lot of teeth that were on really their last leg. And
Yeah, let's put these x-rays up.
yeah, so you can see the
and
x-rays.
we'll point to all the areas, but you can see there's going to be a lot of arrows here. She had
many teeth that were, just non-restorable and needed to be taken out, but zero pain. Absolutely
pain.
none.
I was shocked. So Dr.
Yeah.
Juricek and I were discussing her treatment plan, and I was like, well, where is she hurting? And she was like, she's not.
Yeah.
And that's not the first time I've seen that. It's, typically it is more painful when the mouth looks in this condition.
Right.
But pain is not a good indicator. In fact,
Absolutely
sometimes somebody said this one time, and it's 100% true. You can lay a hair across somebody's teeth, and they'll be like, "Oh, doc, my bite is all off, and everything feels fine." And then other people, you could glue a quarter to it, and they wouldn't even feel the difference. And so I don't know why some people are way more like
Princess
sensitive.
and the Pea,
Yes.
with their teeth.
But I tell you, and I've said this so many times in my career now, you cannot trust pain as the indicator of whether or not you need something, looked at, because many of these issues are silent until they are a problem, and usually when they start to become really significant in pain, it's a big problem.
Right.
So don't ignore it if you have it, but at the same time, just because you don't have it doesn't mean that you're A-okay. And I'm not trying to say that everybody needs immediate care, of course. But too many of you guys come in with a lot of challenges that are never painful. But if we don't see them beforehand, we're on the verge of losing multiple teeth.
And at risk of infection, swelling, and then one day, fever, and then they're in the ER, needing to get antibiotics and all these things. So we just want to prevent that from happening. And so
hope you learned something today on the takeaway. Dental pain does not mean problems, and problems don't always be accompanied by pain. Yeah. Anyways. I had a good day. Glad you did too. I think I did some implant restorations. Really cool case where we had done arch development on an adult. I think she's in her 60s, and made space for premolars that she had taken out, like my case. And we actually put in implants back into those spaces. Yesterday, we actually restored those teeth. I don't think I have a photo to show you guys, but anyways, always creating space, always putting things back, trying to give people back what God gave them, I guess.
Yep.
Yeah, it's a lot of fun. Hope you all took something from this today. Thanks again for watching. Don't forget, click, subscribe, share, send this to somebody.
See you next time.
And we'll